Welcome everyone to tonight's mental health webinar. The title for tonight is there a problem with anxiety? So I guess even myself, I've been worrying about this webinar for myself. So there's some kind of anxiety myself, yeah. So no worries, today Dr. Chester is going to explain more about what is anxiety. Okay, first, maybe let's introduce our special speaker for today first, yeah. So, okay, so wait. Okay, so tonight we're very honored to have Dr. Chester Chong Seng Choi, yeah, from UPM to be a part of our special speaker for today. So Dr. Chester Chong is a consultant psychiatrist, senior lecturer, and currently the head of psychiatry department at Universiti Putra, Malaysia, UPM. His professional experience includes working at Hospital Kajang, Hospital Kuala Lumpur, and now Hospital Pengajar UPM. He is a member in the Malaysian Psychiatrists Association, MPA, the president for Malaysian Educational and Psychological Wellbeing Society, as well as the founding member of Kuala Lumpur Psychoanalytic Group, alongside other prominent psychoanalysts from the British Psychoanalytical Society, in which he serves as the treasurer. So apart from being the regular reviewer for journals like Current Psychology and Malaysian Journal of Medicine and Health Sciences, he has also published 16 peer-reviewed articles up to now and gaining the H index of 5. He has a few research grants from the university and is currently participating in phase 3 clinical trials. Utilizing his expertise, he has previously provided numerous national and international crisis supports. He also earnestly delivers workshops for psychiatric colleagues and gives public talks to raise mental health awareness. He mainly works with adults within the psychoanalytic and mentalization-based framework in psychotherapy. His professional interests include the understanding of severe emotional disturbance and personality disorders. So that's a very brief introduction about Dr. Chester. So if in case Dr. Chester wants to tell a bit more, it's okay as well. We still have a little bit of time.
Oh, okay. I think good evening all. Welcome to the webinar. I would like to extend my gratitude to both Kenny and Miss Hui for inviting me to speak on this webinar. I hope my voice is clear enough. So because I didn't use the earphone over here. Okay. So yeah, thanks. I would say it's not brief at all. With the introduction, you have given a very kind words about me. Thank you so much. So I
Okay.
think nothing more to add.
Okay. So maybe let's kickstart. Yeah. Let's jump straight into the topic. So I guess everyone is very curious. So what is anxiety, and when does it become a mental disorder?
Okay. So in order to answer this question, right, maybe I can start off by asking Miss Hui, do you feel anxious right now?
Yes, definitely. I have to tell you that I do have a stress ball with me right now.
Okay. Yeah, you can see the amount of anxiety that Miss Hui is currently experiencing. And perhaps even though you look at me, I feel like, maybe you look at me as not anxious,
Very calm.
but actually, I cannot also shine away from a little bit of anxiety still coming from me, you see. So my point is, anxiety is a normal emotion, a normal reaction. So we do not need to pathologize these emotions. It is our brain response or way to react on stress or alert you about danger. Okay, so classically, when someone feels anxious, it is associated with an uncertain situation, unfamiliar situation that we perceive as dangerous. So everyone can feel anxious now and then. For example, you may feel worried with a problem at work or before taking a test or before making an important decisions. But what I'm going to say here, all these situations where we feel anxious is perfectly fine. However, in the case of anxiety disorders, there are differences. When we have the words disorders associated with an anxiety, it denotes a condition when the anxiety, the feeling of anxiety started to cause problems to one's life. So usually, anxiety disorder in a psychology or psychiatric or in a clinical condition, we see that is a pervasive and concerned, overwhelming anxiety feelings. So the keyword is pervasive anxiety, concern, and overwhelming anxiety. To the extent it causes disturbs, in one's functioning or daily routine of life. So someone can feel excessively anxious until they chose to avoid to work, to go to school, to have interaction with families or any social situations. So the quality of this anxiety, when it becomes a disturbance, a nuisance to someone's performance in life, it is what we call as anxiety disorders.
Doctor, what about like, is there a duration, or so what if it's only because I have like exam coming up, so that's why I feel like the anxiety pick up certain period of time, or do I need to observe, does it takes longer time, or what is it?
Yes, you are right, Ms. Wei. So this is a very on-point question. Until when we say this is pervasive and long enough, there are keywords like, for example, the quality of the anxiety have to be persistent almost every day. For example, in the case of generalized anxiety, almost every day for most of the days. Then there are criteria of duration, how long, the anxiety before it become a disorders. So usually we give a cut-off point between 1 to 6 months. So it depends on the type of diagnosis or type of conditions. So anything between or less than 1 month, for example, in a reaction to a stress, we call it adjustment or adjustment disorder with anxiety symptoms. You are adjusting to something, to a life event, to a changes in life. With coping and resilience, adjustment can resolve and the anxiety can disappear. However, when these feelings persist for more than 1 month, and even in worse situation when it's up to 6 months or more, definitely this is what we call disorder because it's prolonged. So to answer your question, at least 1 month.
Okay, so maybe doctor, you can explain a little bit more, as in like, is there any group of people that are more prone to having anxiety, as in general?
Yeah, thank you for the question. Yes, certainly, as with all psychiatric conditions or mental illness, we are looking at the point of risk factors or predisposing factors. What factors, what kind of things actually predispose us to be at risk of getting mental illness? So no single factors, shall I say, no single factors actually predispose one to a mental illness. So usually in psychiatry or mental health conditions, we are looking at a multifactorial kind of pictures. So it is not just presence of a single factors, but a combination of multiple factors that actually increases the risk. So in the case of anxiety disorders, we are looking at risk factors, for instance, history of mental health disorders. For instance, having another mental health disorders like depression or substance use, that can actually predispose to anxiety disorder. Having eventful childhood experience that is unpleasant, in the form of abused, whether it's sexual abuse, physical abuse, or emotional abuse, or any kind of childhood trauma, also can be a factors. If we were to look into presence of physical illness or chronic physical illness, that and also actually increases the risk of getting anxiety disorders. For examples, someone who have diabetes, heart disease, hypertension, asthma, or even painful physical disorders. We are also looking into the characters of the persons, the personality of that persons. Someone who is anxious to begin with, even at child time. The temperament is actually someone who is having low self-esteem, difficult to tolerate anxiety, difficult to tolerate frustrations, or perhaps they are shy, and these are actually also the predisposing factors in terms of the character. And of course, we are also looking into the upbringing. The upbringing, for example, the childhood experience living in the family with the parents, the way they are being brought up. And these are also another risk factors. So what we see, again, is not a single factors, but a combination of the personality, the childhood experience, the vulnerabilities throughout the life, be it trauma or any kind of life events. So it can actually predispose to anxiety disorders.
Okay, so that means it doesn't just one item that causes anxiety. Definitely there's a few factors together. Yeah.
Yeah.
Okay. So what about panic attack? Sometimes we kind of confused between these two. Yeah. The anxiety can build up until like feeling a panic.
Yeah. Yeah.
So maybe doctor can explain a little bit more.
Yeah. So this is a phenomenon, shall I say, like it happens quite frequently when people classically describe a sudden surge of feeling fearful, okay? And usually it happens out of nowhere, and there's no factors, or there's no events that leads to that sudden fearful feelings. And during this attack, you may get a rush of intense mental fearful feelings, like what I say, and also a physical symptoms, a combination of physical symptoms such as palpitation or raising heartbeat, feeling faint, giddiness, sweating, nausea, chest pain, shortness of breath, trembling, hot flushes, chills, shaky limbs, choking sensation, dizziness. So you can see there are various physical symptoms that can happen during a panic attack. But what I'm saying is that it's not just the physical symptoms, but it is also a combination of emotional symptoms, like what I say, the fear is an intense fearful feelings out of nowhere. And also, there are also some things that runs in the mind of a person having panic attack, classically described as 3 types of fears: fear of dying, fear of losing control, and fear of going mad. So you can see there are physical symptoms, emotional symptoms, and what we call as the cognitive symptoms or the fears during the panic attack itself. So, but the classical panic attack usually transient, usually lasts not more than 15 minutes, but it surged, to reach a peak where all the symptoms intensify before it resolve. And even though it is brief, but the nature of the fearfulness that it causes is terrifying to the persons. So therefore, you see, when people have panic attack, it just don't stop at a single panic attack sometimes, or most of the time. Because of this single episode, the person will get very worried of subsequent similar attack. So, like I say, it doesn't stop at one attack. Because of the fearful feelings of, will I get another similar attack? Someone might choose to avoid certain social situations that he or she might think can bring about the next panic attack. Or he would choose to become more maladaptive in terms of his lifestyle. So it's a combination of these, then it becomes a panic disorders. So I say, shall we say that the panic disorder is a combination of fear in between panic attacks. To the extent he chose to become avoidance in his life, and that's not just a panic attack, but it becomes a panic disorders.
I see. So maybe you can explain a little bit on during that situation. Say there's one that's going through panic attacks. So is there some way or somehow that person can help? And the feeling is already out of control, but they're trying to control. Yeah. So that, but sometimes I like palpitation and all this are difficult to breathe and all that. So
it's always not easy to control that feelings. Especially during the peak of panic attacks, when every symptoms and the fears is at the peak of intensity. You see, classically people would just say, I need help, I need to go to the hospital, I need someone rush to me, I cannot faint. What happened if I faint, you see? So there's the intensifying fearful feelings during that point of time. So classically, people don't die because of panic attacks, even though the feelings, the sensation, the symptoms feel like they are going to die. This is a myth that a lot of people are actually having. Because I believe it's because of the nature or the quality of the panic attacks. It feels like I'm dying, but the true nature, you're not dying, even though you felt like you're dying. So I think the first step is the ability to actually calm yourself and taken aback and say that, no, this is a panic attack, and I need to cool myself down as quickly as possible. Even though it feels like I'm dying, no, I'm not. So the ability to say that is part of the first step. Of course, during the intensity of the panic attacks, we also encourage people to take a deep breath. Try to slow down your breathing as much as possible. So with anxiety, breathing is going to become fast and short. And when this happens, oxygen is not going to be enough to the brain. And when this happens, you are going to be more anxious, with hyperventilation. So we usually advise patients to slow down your breathing during the panic attack itself. Find a quiet place, where you can be totally calm, sit down, take deep breath, close your eyes, calm yourself down, keep on reassuring yourself, this is panic attack, you are not going to die. Or perhaps you can also find something else to distract yourself. Find a focus object to distract yourself. And this can actually comes to place, for example, making a phone call to talk to your friends, reach out to your family. You can also perhaps, in most of the cases, that are the patients that I see, they rush to the hospital, especially during the first or few episodes, the first beginning stage, because that feels the safest for them to go to the hospital or any clinic to get it checked. Am I anything wrong with my heart or with my lung? So, but classically, when I listen to my patient, they say the moment when they reach the hospital, even before the doctors are doing anything, the symptoms disappear.
Because it takes about like 15 minutes, right? Like that's what doctor was saying.
But I think it's also because of the psychologically, when you reach the hospital, you feel safe. Yeah. And there's a lot of patients with panic disorders. They don't feel safe to the extent that they can't leave the house alone. For example, they might be having needs of having someone to beside them when they go out or when they drive alone. So because they feel safe. So I think another way perhaps to stop or prevent a panic attack is actually how to make yourself feeling safe. Just to share before I pass back to you, Ms. Wei, is like there are patients who see me when they are being prescribed with medications, a tranquilizer. Sometimes they do not take the tranquilizer, the calming pill, but they just keep it with them because it feels safe for them.
So it's like as and when if they feel like they need to, they have it. That they feel safe to having that with them. Yep. So what I hear is like, so doctor was saying is like, first is to acknowledge that I'm going through a panic attack, and then probably need to deep breathing. That's another one. And or distract myself by maybe make a phone call or look at some things or hold on to something. Yeah. And then of course, worst come to worst, if I still can't just go to the hospital.
Well, that's especially during the beginning when we do not have much knowledge about what is actually happening.
Yeah.
Just before I forget, there is also a techniques that shared by my patient when they have panic attacks. Of course, you can't do this during the peak, but what he does is actually he draw and he colors. Perhaps that's some things that we can categorize it as a distraction, you see. So by being mindful of the feelings, using the sensories, by drawing and coloring, you're using your eye, the coordination of the hands. So you pay attention to now the task of drawing and coloring, and it becomes like a mindfulness practice that distracts away from the anxiety.
So I believe, doctor, that most people may, when they experience panic attack, they wish that they can kind of like rewind back where they don't have that at all. So would by practicing like mindfulness able to kind of like calm themselves and then eventually cut down the frequency of panic attacks?
Yeah. Because research have shows mindfulness treatment or mindfulness-based psychotherapy has shows a significant ability or effects to reduce the anxiety. The technique is actually encouraging someone to utilize our senses, be it the eye, the taste, the sensations, the hearings, all these sensations to be drawn onto now, and because when we anxious, our minds lingers to future and or perhaps into the past. So it's very difficult to stay on now. So with a repetitive mindfulness exercise and practice, we are actually trying to train our brain to stay with now, but not linger to future, go to back, it's really like a monkey mind.
Yeah, doctor, you just spot on to the next question, because usually people would say that I overthink a lot, like, especially just before bed. They'll be thinking so many things in their mind, and then they couldn't sleep, and then they get anxious about like not able to sleep, and then what can I do? This cycle seems to be going on and on and on. So helpless. Yeah.
Indeed, you see. So I often tell my patient, the enemy is not the situation that you encounter. The enemy is your own mind. So it is our enemy that we have to face, and is actually coming from ourselves on how the minds and the thoughts are actually attacking and bring us feelings of worries. So overthink is actually one of the common phenomena that easily bring out anxiety feelings.
Mm.
And classically, overthink is a form, of negative thoughts.
Yeah.
Usually, it is associated with negative thoughts. You might fortune tells, you might magnify problems, you might personalize problems. So overthink carries these negative uh, connotations, you know.
Mm-hmm.
So how not to overthink?
Yeah.
First is actually, again, acknowledge that we are overthinks, you know.
Mm-hmm.
I think the ability to be aware, oh, I'm actually overthinking again, that's very, very crucial. Then you might want to step back and look at how you are actually responding. You know, that's not easy. Sometimes we need some people to point out that to us that, come on, you're actually overthinking right now. Um, when, in situation like this, where we feel like, oh, I'm actually overthinking again. So the next step is actually how not to overthink, right? We might find a distractions. Again, distraction comes in during anxiety.
Mm-hmm.
Learn some new skills, going to favorite workout class, taking up a new hobby, volunteering, all these things can be a constructive distractions, because the reason I'm saying that distraction is crucial, a lot of time people feels that they overthink the moment they feel quiet or alone. And
Mm-hmm.
that's why people overthink a lot at night before sleep. Because we can occupy ourselves throughout the day, but we cannot keep on occupying ourselves at night, you know.
That's true.
So, so at night, how to stop the overthinking at night is very crucial. So there are physical strategies or things that we can do, like taking a deep breath before you go to bed, meditate, listening to soothing music, or reading some calming uh, prayers or mantra, or if you are reading into Bible, then you can read, things like this is what I call get into spiritual mood. Yeah, perhaps
Mm-hmm.
that
Mm-hmm.
can be helpful as well. Um, in regards to the thought itself, there are certain strategies that can be utilized to combat the overthinking. For example, you might jot down what you actually overthinking at this moment in a notebook, you see. So
Mm-hmm.
what we call as a thought diary. You
Mm-hmm.
write down in a notebook on what is your worries. Perhaps we can become clearer, the moment we recognize our thoughts, what worry us. When we can see it, it gives a feelings that we are actually trying to master it. But when it becomes still like in the mind and it just crumble up in the mind, and when we don't see it, we feel more worried and anxious. So my recommendation, perhaps, write it down before you go to sleep.
Mm.
Um, and as you write it down, also you can also start to practice prioritizing these worries. Maybe you can see a few worries as you write it down. What kind of worries need to be attended to, as your first priority? As you do that, you might perhaps realize, actually not all share the same priority, and things might not be as bad as I thought it is.
Mm.
Another thing, as you write it down, you can also try to do it like the problem solving. As you write it down, you can also try to think about some possible solutions, and it is perfectly fine if you cannot find out the solution in that case. But the general feelings of when you write it down, you see, before you go to bed, perhaps text give you a sense that I chunk my problem on the book. Now I can go to bed. Next day morning, I pick up my problem from the book and I continue with my life. So hopefully, these are some of the strategies that we can actually practice.
Yeah, yeah. These are
Yeah,
really good because what you're saying is more of like prepare a worried list and then start to look at the list and start to look at prioritize which one we
yeah,
could actually handle first. And then that also includes like looking at possible solutions to the worry that I've been thinking.
yes.
Mhm,
I saw someone in the chat group saying running. That's true. Physical exercise, the
mhm,
correct amount of physical exercise may be a strategy to unplug yourself, you see. So we spend a lot of time working, reading, studying, or trying to achieve something. We need time off, me time to unplug, you see. Maybe we can shut off our computer, our phone for a designated amount of time each day and spend that time just for yourself. You know, you can do a moderate amount of exercise, eat mindfully, get outside, talk to someone, or even seize the greeneries, take the fresh air outside your homes. And all these minor things, which I believe, is the combination of effects that will help.
mm. Yeah. So what about if as a friend, how can we help someone who has anxiety disorder?
Mhm,
Because what just now a doctor mentioned is it's more about myself. Like if I have, then what are the things that I can do to
mhm.
calm myself and all that. But what about as a friend? How can we help another person?
Yeah, we always have this urge to help someone,
Mm,
yeah, especially those of our loved one, yeah, shall we say. And during during this eagerness, you see, sometimes can bring more anxiety to the person who already feeling anxious.
mhm,
Yeah, because our strong urge to help them. Um, I think the first step is actually trying to reframe ourselves from doing so. So the first things is actually active listenings. Just like what Miss Hui, you told me in your Befrienders work, you approach the clients with active listenings, right? So
yes.
that's very crucial, I believe. The act of listen, the ability to listen, not necessarily acting at that point of time. By being present and listen deeply and compassionately, that's help a lot. Sometimes we might not be need to say anything, but I used to have a patient who say, doctor, I enjoy the session because I felt like I have someone to listen to me. So it's not about what you do or what you don't do, but your physical presence that matters. Next is don't try to fix their problem, you know,
Mhm,
uh, is about offering support, but don't take over
mm,
their road. And avoid saying that you will get through this, you will be fine, avoid saying these things. I'm sure you will also agree with me, right, Miss Hui?
yes, yes, yeah. This is also part of our training. Yeah.
Yeah.
So that's true. More important is like staying with them, just
Mm,
listen to them and be present. Yeah, I think that's the key, so that they know that they are not going through all by themselves, but there's actually a support there that's next
yeah,
to them. Yeah.
sure. And also you can also ask your friends what they really need. Ask how you can help. Match your support to their preference. Not everyone's need physical supports. Not everyone needs you to check on them frequently. Maybe
Mhm.
they need space for themselves. We need to match their characters with their needs. Most importantly is like keeping them accompanied, um, either remotely or physically at certain period of time. And more importantly is check on them occasionally, depending on how severe is the anxiety and their characters. And most importantly, I say is the last step is, which is what I mean is, if you see things are actually beyond your help, you might want to support them to seek help from a professional.
Mm,
So you might want to help them to arrange appointment, give them a ride to the hospital or the clinic, accompany them to see the doctors, all these tiny small gestures that really speaks, about being a friend.
mm, mm, mm. So, so what advice would you give to someone who is like really struggling, when you just mentioned that you seek for professional help, and then they're like so afraid of to go to see a psychiatrist.
Mhm.
I mean, partly definitely it's because of the stigma.
Yeah, you are
Mhm,
right. I think you also experience that a lot with befrienders, right? The
mhm,
stigmas is something that almost like the biggest factors that prevent people from seeking help to see a psychiatrist, a psychologist, or counselors.
mm,
I think the stigma is not just in Malaysia, but it's everywhere in the world when it comes to mental health illnesses. So we have to be sensitive to these issues. Why that person chose not to see a doctor's or a psychiatrist or psychologist? Why the person chose to keep everything to himself or herself?
mm,
So have we tried enough to understand from their point of view why they are doing that, and be sensitive on that? That's the most crucial things, I guess. And from that, we can try to understand how next we can prepare for help, you see. So when we understand the reason why they chose not to, we can prepare for resistance coming from them. Resistance is going to happen with this group of people who refuse to get help. You may already set up an appointment to bring them to see someone else, and the next day they say, no, I don't want to see. So this is a form of resistance. So I would say try to use your relationship as a leverage in a loving way, you see. Don't force, but showing consistent gesture of kindness. And perhaps you may also explain certain specific areas of their problematic behavior without coming off as judgmental, by genuinely showing them that you really want to help and you see that this part of the situation is the problem and they need to get help. So maybe that is one of the strategies. And the last but not least is to motivate them, you see. We have to motivate these people to get well, to get better again. So give them confidence that they can actually go through this together with you. Um, yeah, I think that's the keywords over here
mm,
about how to get someone who is so afraid from getting help
mm.
from a mental health professional.
Yeah, interestingly, there's another question from the floor is that how can we encourage our peers that having symptoms of this mental illness when they are in denial syndrome? Probably what she meant is like in denial, means
Mm,
they know they have problem, but then they deny going to seek help. Yeah,
yeah,
rather than afraid of seeking help. Yeah.
yeah. Well, we are looking at denial, and denial is a strong defense, you see, to something painful. When we look into denial, it is not always uh, abnormal, or it's not always pathologized, you see. There are times that when we deny on things and we are able to move on and keep on living. But there are denials that comes on destructive or problematic when it becomes so strong that it hinders the way we live. In this case, seeking treatment when you see that he or she needs to get help. So first of all, we also acknowledge that there is presence of denial, and perhaps you can ask yourself, does the patient or does the person knows that he or she is in denial or not? That's the first thing. Second thing is that how can we overcome this denial? Are we in the position to overcome this for them? Or are there any better person to do it for them? Do we have the quality of relationship that is good enough, to work this denial? Or there are any other people, for examples, relatives, other friends, spouse, that can actually do it better than your positions, And perhaps the third thing is about trying to understand and talk to them about their struggles. Try to find out what is behind this denial,
So basically what doctor is saying is like, go back to what is the resistance behind this. Yeah, what is like actually stopping them from actually wanting to seek help?
Yeah, besides stigma, refusal to get help can also comes into other factors. For example, logistic reasons, cost, past bad experience with the doctors or psychologists,
True.
past experience of seeing someone who is not getting well, and it kind of instilled the thoughts that no point of doing that. So we need to understand behind the denial, what are actually hiding on, you see.
Okay, so I think we only have like 10 minutes left, and then we want to save some time for Q&A, right? So what are the options in terms of treatments that's available for anxiety disorder?
Okay, thank you for the question. Anxiety disorder is a common but treatable conditions. Treatment options can include taking medication, which what we call as anti-anxiety medications, that helps to regulate the chemistry in the brains, as it is one of the factors that can predispose to feeling anxious. It is and other forms of treatment also includes talking therapy or psychotherapy. So for example, cognitive behavioral therapy is one of the effective way to reduce anxiety. And in most cases, most situations when anxiety is so severe, is a combination of these two, medication and talking therapy. I think just before I pass back to Ms. Hui, I want to advocate that this recovery from anxiety is possible, but recovering from anxiety can be compared to a jigsaw puzzle. You see, there are many pieces you need to complete in order to get the whole picture, and they cannot all be put in place at the same time. It has to be done piece by piece, but eventually with a bit of determination and hard work, the picture can start to become clearer.
That's a very nice analogy. Thank you, doctor. Yeah. Okay, so there's one question from the floor is, which is more effective, counseling or take medication? So the doctor did mention that it can be done in both at the same time.
Yeah. Both are actually effective, Of course, there are studies trying to compare which one is more effective than another. I would say it depends on the severity of the anxiety that the person is having, the past response, personal preference, and the amount of impairment of that anxiety is actually inducing on the persons. In most severe cases, someone will need a combination of two. Because if you want to look at it this way, you see, I give you another analogy. If someone is feeling so anxious, he or she definitely cannot sit with us going for psychotherapy or counseling. The mind is filled with some things. There's no space to absorb whatever techniques or skills that we're trying to teach, So we need to lower down the anxiety a bit using medications.
So what I hear is probably to kind of like calm them down through medication, and then probably later then they learn about CBT so that they can regulate and learn how the skills to manage the anxiety.
Yeah. The talking therapy would be something like, I would say, once the acute phase of anxiety is lower down, there's talking therapy helps to prevent the future occurrence of anxiety, because it changes the way we thought, the way we see things. You see, you have a longer lasting effects.
Okay, that's very, very clear understanding of the treatment options. Yeah. Okay, so let's see what are the questions that are posted here. Okay, so Nicole asked about referring to the distraction in managing anxiety. So what if an individual indulges in an unhealthy way of distraction, such as binge watching Netflix? This would still disrupt their life as they rely on this and not feel anxious.
Yeah, I guess next binge watching Netflix is quite prominent nowadays. Yeah. I say with all distraction activities or strategies, it is about moderations. I see. With all coping mechanisms, is about moderations. If we were to look into like what is so-called an unhealthy way of distraction, like binge watching, certainly this is unhealthy. Same with like someone might want to cope with excessively drinking to calm themselves as a form of self-medicating, you know. So certainly on all these are unhealthy ways of coping.
So it's still moderation is the key, like in other words, no matter which method that they prefer. Yeah.
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 So another question from Sakina is, what is considered as full recovery from anxiety? Can one fully recover from the condition?
I believe, and I chose to believe, recovery is possible. It's just that have the persons receive the correct and good enough treatment for the anxiety to recover. So a lot of time when we see that, anxiety is not recover, the disorder is not recover, perhaps it's about the characters, the way the person is thinking is still having, perhaps I would say, it's still faulty, you know. Imagine if you were to repair a car, this car is having anxiety disorders. We can paint, we can change the tire, we can change the air cons, a lot of things that is actually happening that cause this car to be anxious, to be anxiety. But the main thing is still, what is the root cause of the problem? If the root cause is about the engine problem, then we have to change it. We have to modify it. So I would say recovery is possible depending on how much we are targeting on.
Okay, yeah. So next question, I think probably let's take another last two. Yeah. So, okay, there's a question from LS Hong about the medication being addictive. So maybe doctor can explain a bit more.
Yeah, sure. So thanks for the question. I think that's a very valid questions. A lot of patients that come to psychiatric clinic, they got the impressions that medication will be addictive. Well, my answer is that it depends on which type of medications. So if we are talking about tranquilizer in the forms of benzodiazepine, sleeping pills, or calming pills, in scientific terms, we call it benzodiazepine. These are medications that can be potentially causing addiction. But the anti-anxiety pill, that is used to treat anxiety is not addictive, because it is a medication that is approved for the treatment of anxiety disorder by regulating the brain chemistry in the brains. So if someone just focusing on taking the sleeping pills and the calming pill without getting the anti-anxiety pill, there might be risk of getting addiction. So I give analogy of, if you have fever and you take Panadol without taking antibiotic, so the fever is still there, and you have the chance that you cannot let go of the Panadol.
Okay, Okay, so I guess go back to like, regarding medication, is really important to always go back and seek the professional like psychiatrist recommendation, and not just take pills by themselves or prescribe by themselves and all that. Yeah, because it needs to be a combination and not just take one per se.
Yeah.
Okay.
Yeah.
So this is question from Hayati about counseling session must be with psychologists or other therapy can also help. I've tried hypnotherapy before COVID-19, but stopped halfway since I don't see much progress.
Well, counseling session or psychotherapy can also be done with other mental health care professionals like psychiatrists, counselors, or any trained personnels. In your case, perhaps a hypnotherapist. Yeah. So it is not just psychologists that can offer counseling or psychotherapy. So there are many types of psychotherapy out there, but the one that has a lot of evidence or empirically tested to treat anxiety is, like I said before, the cognitive behavioral therapy.
Okay. Okay. Yeah. Thank you, Dr. Chester. I guess that's all for now. Yeah. Then regarding Nova's question is about the any government clinics that I can go for consultation. So I believe actually there's all the general hospitals, they do have a psychiatrist department. Yeah, so you can actually probably go to the nearest clinic first to get a referral letter, and then you can make appointment to go to the nearest general hospital psychiatrist department to get help. Yeah. I hope my information is correct, yeah, Dr. Chester.
Yes, you are correct.
Okay, okay, yeah. Thank you so much, Dr. Chester, for the time. So thank you so much for take time off. Yeah, I know you're very busy, so and you're still replying text messages just now. And then thank you so much.
You're most welcome, and thank you everyone for joining us.
Thank you, Doctor.
Thank you.
Okay, before we leave, for those that would like to help us as a Befrienders NGO, you can do the donation through this QR code. Yeah. For donation that's above 50, you can just email the proof of transaction, and then the admin will send you the receipt. Thank you, everyone. Have a good evening, everyone. Bye.
Bye.
See you again, Dr. Chester.
See you. Bye-bye.
Okay, bye-bye. Thank you very much. Good night.